Ergin Koçyıldırım. Dr. Koçyıldırım will be joining us from Pittsburgh, USA, to speak about the sharp rise in coronavirus cases across Turkey. But first, let's take a look at the coronavirus-related developments of the week. Concerns are high as the sharp rise in positive cases continues. Numbers provided by the Ministry of Health, contested since the outbreak of the virus in Turkey, continue to be disputed as medical professionals from around the country voice their concerns and worries regarding the lack of space left in outpatient clinics and intensive care units, as well as the increasing number of medical professionals infected by the virus.
On Wednesday, Health Minister Fahrettin Koca stated that Turkey had reached the second peak of the first wave. He said the capital Ankara is now the province with the highest number of coronavirus cases in Turkey, producing double the numbers of Istanbul, previously the outbreak's epicenter in Turkey. Fatalities have jumped to their highest since mid-May, when lockdowns were in place, and new cases have risen to mid-June levels, at almost 1,600. Turkey mostly reopened the economy and lifted weekend and age-specific lockdowns in early June. Following Koca's remarks, the Interior Ministry issued a circular announcing new restrictions on weddings and other social gatherings. Weddings have been limited to an hour, with all food and drinks banned. The attendance of senior citizens and children to such gatherings has also been prohibited. Further, Minister Koca announced the number of infected health workers for the second time during the pandemic, stating that 29,865 healthcare professionals contracted the virus and 52 lost their lives. The metropolitan mayors of Ankara and Istanbul have accused the central government of covering up the true scale of a coronavirus resurgence in the country. Ekrem İmamoğlu, the mayor of Istanbul, and Mansur Yavaş, mayor of Ankara, said there was a mismatch between the statistics being published by the health ministry and the data they were receiving on a local level. Right now, Istanbul is most equal with the Turkey data, the data that is being given, İmamoğlu said in a webinar on coronavirus organized by another opposition party on Saturday. He added, "These contradictory numbers are really bothering us. I've written to the health ministry 4 or 5 times. I personally said, what is this? There needs to be transparency." Yavaş echoed İmamoğlu's concerns, stating, "What benefit is there to underreporting the numbers? In my view, it should be the other way around. Otherwise, people won't stop going to weddings, going to funerals, they won't stop gathering together." Their decision to go public with their concerns about the COVID-19 statistics follows warnings by Turkish doctors and medical associations who have said for weeks that central authorities were downplaying the scale of the problem. According to the Turkish Medical Association, based on antibody tests, there are likely some 10 times more active coronavirus patients than suggested by the official tally. However, Koca stood by the accuracy of the official tallies and urged people to be more cautious. Meanwhile, Ali Babacan, Turkey's former deputy prime minister and founder of the Democracy and Progress Party, had announced on August 25th that he was infected with the virus and would stay in quarantine with his wife and son, who were also tested positive. On September 1st, he stated that he will continue his COVID-19 treatment at the hospital. Babacan urged everyone to take COVID-19 seriously and to follow precautionary measures closely. Binali Yıldırım, a lawmaker from the ruling Justice and Development Party who has served as minister and prime minister under President Erdogan, announced on September 3rd that he tested positive for the novel coronavirus. Yıldırım said that he is in good health and entered home quarantine with his wife Semiha Yıldırım, who also tested positive for the virus.
This evening, our guest is Dr. Ergin Koçyıldırım. Dr. Koçyıldırım is an assistant professor at the Department of Cardiothoracic Surgery at the University of Pittsburgh in the United States. He'll be joining us tonight to speak about the sharp rise in coronavirus cases across Turkey.
Good evening, Dr. Koçyıldırım. Thank you so much for joining us.
Good evening, thank you.
So, since the outbreak of the virus in Turkey, the official numbers provided by the Ministry of Health have been contested. Nowadays, reports coming from regional medical associations further iterate the lack of accuracy of these numbers. While this may be the case, and we will be talking about transparency in a bit, the official numbers that are provided are nonetheless worrisome as they signal a sharp rise in deaths and positive cases. Is this increase due to a problem in the management of the pandemic coming from the authorities, or are they due to individual lack of attention? I mean, Minister Koca just 2 days ago suggested that the rise in cases was due to people not following the rules of social distancing, hygiene, and mask wearing as they're attending weddings and funerals and so forth. So is this really the source of the problem in your opinion? And perhaps you could also do a comparison with the current spike in numbers in the USA as well.
Thank you. Minister Koca had a press conference yesterday I think a similar question was directed to him too. And then he blamed the most recent gatherings and relaxations of the precautions. And then he said that all those numbers are due to especially the wedding ceremonies and some other crowded events. But I believe this could be one of the main reasons of the most recent high numbers. But if you look at from a scientific perspective, and especially from an epidemiologic point of view, I think the lockdown or just the quarantine precautions were not really taken seriously when the outbreak is at its highest. Those, especially in March and April, because we're just getting close to those numbers, especially in the rates of the death. Those days, Turkey followed some very interesting precautions, like keeping the population at home over the weekends. And to my knowledge, Turkey was the only country globally applying this kind of weekend, lockdown processes. So I believe in terms of mitigation and containment of the virus, those precautions were not really helpful. So as Minister of Health, Dr. Koca mentioned yesterday, that this is the second peak of the first wave. So also from the very first day of the outbreak, there has been some concerns and trust issues through the numbers and the data that has been shared. And also you think that over the last 3-4 weeks time, the green tables that were just announced every single day has a significant change. Previously, we were having some information about the intubated patients and the number of patients in the intensive care units. Unfortunately, those numbers are stopped to share, and then they just put some sort of swear patients, and also the rate of the pneumonia, which scientifically has no value to know. So like you said, there has been always a concern about the transparency and then the level of data that has been sharing. But I think the main reason of this high numbers are due to the wrong precautions. If we just compare this with the United States numbers, yes, United States is still just the #1 country globally, has the highest number of cases and death numbers. When we look at the states, California is just the biggest numbers are coming from California. But when we just compare Turkey versus US, we have to just know some sort of little bit, data about this. Let me just tell you about California. California is the highest populated state in the United States. And if you just compare the population of the state of California, it's higher than this Canada. So we're talking about a state which is the same size of a country. So that's, but I think the main numbers that we really need to be careful is about the number of cases, detected cases per capita, which is 100,000. So if you look at the California numbers, still the numbers are 567 per 100,000 population, which is still lower than Arizona, which is still lower than Florida and some other states. So what happens in the United States? United States is just putting a lot of effort in testing. The number of tests in the United States is about 900,000 yesterday, and it's just almost gonna reach to 1 million per day. And the contact tracing was not a very well focused thing in the United States, but now contact tracing is very important. While you just put the diagnosis and when you just isolate the patients, the next step is just to do the contact tracing to find, the possible contacts of this person. So the contact tracing numbers are getting higher, especially when we look at the state numbers. In California, when the outbreak is at its highest, is now 85% of the patients has been contact traced. United States is also very a unique country because there are some ethnic disparities. If you look at the California, 56% of the diagnosed COVID-19 cases are Latinos. And if you look at the deaths, unfortunately, 42% of the deaths are from the same population. Just for the California population, almost 39% of the population is Latinos, and white people are just following it with 37%, I believe, population. But the number of COVID cases in white population is only 17%. So Latinos are from the low-income communities. So coming from a low-income communities is a problem. And also in those communities, people are usually working as an essential workers, so they can't afford to call in sick, so they have to really go to work. And also those kind of essential works cannot be performed from home. So that's why the highest population of those cases are through those ethnic groups. The main reason of the highest numbers in the United States is not only performing the highest number of tests, that's so clear that if you perform more cases, then you can detect more cases, but also there's a lot of relaxation on the stay-at-home orders, like Turkey. It's very similar because government just gave the idea and changed the perception of what the outbreak is and where the people are. So this just created some sort of an relaxation on maybe putting on masks or just keeping your social distance with other people. The other main reason in the United States numbers are also the prisons. So one of the information that we don't know about the prisoners in Turkey is a very strong issue. I think the Minister of Justice just gave some information, I think, throughout the outbreak. I think it was only twice or three times. They were not very comforting results. They gave a couple of results, but seems like we have no clue about what's happening in the prisons. So if you look at California again, 2,500 prisoners got detected with COVID-19, and most of them were out of the prison and they were transferred to another institution. But those institution was also a pandemic hospital, and then this created another outbreak. Lastly, in the United States, we have a little bit issues in the care of nursing homes and senior care facilities. Unfortunately, if you look at the New York numbers and the state that I live, almost 60% of the cases are through those facilities. It is just because of the people who work there are also coming from a low income profile, and also they have to work with by more than one jobs. So still, if you look at the numbers in California and both New York and some other big states, still the care in the nursing homes and senior homes are one of the main reasons that the outbreak has a lot of high numbers.
Thank you, Dr. Koçyıldırım, for assessing the situation in the United States and drawing parallels with Turkey. There are two things that I'd like to come back to. First is the issue of transparency, and later to also talk about testing. But and I know we've spoken about this before, and it's constantly reiterated the importance of transparency, of managing the pandemic in a transparent manner. So perhaps you could tell us why transparency is so important in the management of the pandemic, and how would a transparent strategy help the fight against the virus?
This is a very good question. Thank you. Transparency is very important because if the population or if people know the risks, so it's very easy for them to apply the precautions. So when the outbreak has started in March, CDC, Center for Disease Control in the United States, made a very serious announcement saying that if we don't do anything, we might lose 2.2 million people. So by knowing that a possibility of 2.2 million deaths, people just realized that, oh, we are just facing a really serious situation. And after that, the same CDC made another announcement that if we take precautions like putting on masks, washing hands, some hygienic things, or keeping social distance, we can lower this number to 300,000. So at the moment, we have almost 190,000 people. So whatever modeling or perception they did is just very accurate. So transparency is first thing first very important, that you can just tell the truth to your population. So the population can, you know, obey the rules as you directed them. So the other importance of transparency is also for the scientists. So if you know more data, then you can do more analysis, and also you can be more helpful to your patients. So this is a public health issue. This is an epidemiologic issue. Unfortunately, even the scientific council, which is working closely with the Minister of Health, has some issues that some of the members just recently made some announcements that they just really make some recommendations, but the government was very slow in applying those recommendations to the real life. So transparency. We've been just telling this since the very first day of this outbreak, but I believe, it's my personal opinion, that this has not been done very positively in Turkey. So there has been some sort of level of, I think, suppression in the data. And also our understanding is, as you know, Minister of Health just created another council who is just deciding which scientific articles can be published. So this is just against the freedom of academics, freedom of speech. So, and also this is against the Turkish constitution as number 27, Article 27. So if you're suppressing the numbers, if you're suppressing the scientific studies, if you're just suppressing the academic freedom, then you will just lose the public trust. So there should be a significant level, a core level of public trust when you're just making this kind of dealing with this kind of public health issues. But this trust can be lost quite easily.
Yeah.
So I believe transparency is the core of fighting an outbreak, and this has not been successfully performed in Turkey.
Yeah, and on that note, speaking of trust, I think there was a recent survey conducted comparing whether or not how people felt about the numbers provided by the Ministry of Health, and compared to the month of April, nowadays a lot less people in the Turkish population trust these numbers to be true. So I think the lack of transparency, the fact that more and more figures are being hidden from the public, are exactly transpersing, and the population is aware of that. Dr. Koçyıldırım, you also mentioned that the United States expanded its test capacities, increasing the number of tests conducted each day. Again, 2 days ago, a video was released on Twitter showing the huge lines in a hospital in Ankara where people were awaiting to get tested. So how does widespread testing affect the spread and containment of the virus?
I think in the United States, one of the biggest challenges was to perform high number of tests. And when the outbreak started in March, there was a little bit transition period for a couple of weeks. But after that, US realized that the testing is the main, should be maintained during this outbreak, and then started to perform high numbers of testing. The testing was done, as you know, through a polymerase chain reaction, which is called PCR. Everybody knows those names nowadays. But you have to really get a swab from the mouth and the nose. But nowadays, a new test has FDA approval, emergency use approval, which is a saliva test, which makes the things easier. So first thing first, saliva test is very easy. So it doesn't require a person to take the swabs. And then the other thing is you can just mail those tests. And as you know, the college students started going back to school, and in the United States setting, they really go back to their campuses, even though the education is online. So many universities sent those saliva tests to their students, especially to people who are coming from the center of those outbreaks, hot zones. And this testing is quite important. So if you manage a high number of tests, then you can just get more numbers. Also, there is kind of there's a problem with that too, because Turkey was doing about 40 to 50,000 cases tests a day, and suddenly this now increased to twice as many tests as possible. And one of the press members yesterday asked a similar question to Minister of Health, saying that there are some routine tests from the parliament, from the presidential palace or some other places, and the people were really curious about whether all those test numbers are included with those cases. And Minister of Health said that, okay, we exclude those tests, especially the ones that are performed in the touristical places. So if that is the truth, then the numbers shouldn't stay the same. So, and then also he added to his answer later on while answering somebody else's question, saying that, okay, we just add the positive cases if we detect through those tests, but we don't count those tests. So I think this kind of approach is quite frustrating and worrying and concerning for me, because you're just performing some tests, but you don't count the number of those tests. But if you detect a positive case, then you just add it to your numbers. Testing is very important here. There's one thing that I really would like to mention today is that the saliva test is also coming through the Yale University. And there were, I think, more than 30 companies that were just producing those PCR testing kits previously. Then Yale University came and worked on the saliva test and got their FDA approval. And immediately on the same day, they put the sources on the open source. So they said that this is a public health process, so we just dedicate all this project to the public. So now this saliva test, how to do it, the primers and the compatibility of your existing systems are shared in an open source environment. So whoever wants to make those tests, Yale University is giving a free help. So that's why the other universities started to do saliva tests, because this test doesn't require to make a new investment of new devices, robots, of equipment to make those PCR testing. So whatever equipment or whatever robots or whatever system you have, those systems can easily be applied to your existing system, and Yale University is giving a free help to whole nation. So that's why I believe the saliva testing is very popular. And I hope this kind of similar studies could be transferred to Turkey. Unfortunately, there is a single company manufactured tests available in Turkey, and still Minister of Health insists to perform those tests through those kits. So there is not a second company available and has an approval to do this. So this kind of monopoly things also create some sort of concerns, and it's against our public trust.
Mm-hmm. And I'd like to mention also that tests, I mean, unless you go to the hospital and wait in those lines for hours and hours, tests are also very expensive in Turkey. I mean, you know, above a certain average, you know, that, you know, someone earning a minimum wage would not be able to afford. So in that sense, testing is not very accessible. I mean, you know, if you have any doubts about your health, either you can go to the hospital and wait for hours in those lines without even, you know, a guarantee of when you would actually be tested, or you would have to pay an enormous amount of money, which, as you say, then it causes to a barrier between the ability to be tested and so forth. Another issue, Dr. Koçyıldırım, that I'd like to speak about is the plight of the medical professionals, which is becoming quite urgent, I think. There has been an increase in positive cases and deaths of medical professionals across Turkey. Doctors are asking for early retirement, unpaid leave, or even outright resignations. Many have been proclaiming that if things continue in this manner, the doctors and the system will not be able to take it, and they will crack under pressure. Again, in the press conference yesterday, Koca made a statement about medical health personnel, and this was only the second time that he was addressing them and, you know, their numbers during the pandemic. And even the numbers he provided yesterday are contested. So you tweeted as well yesterday that 11% of the total positive cases are of medical professionals, which is an increase from earlier percentages. What does this mean in terms of the working conditions of medical professionals, and what are some of the major problems they are facing? And what do you anticipate will happen if the lived reality of these medical professionals continues to be taken for granted in this manner?
I think there has been a lot of social media pressure on the Minister Koca to make this kind of statement, because it was, I believe, 29th of April. It was the last time that he made a statement about the number of cases that was detected in terms of the healthcare professionals. In the early times, there was a lot of concerns about the personal protective equipment, and many hospitals and many doctors, many healthcare professionals had to buy them themselves to protect themselves. So after that, Minister of Health take some precautions, sent all those PPEs to every single healthcare professional. But when it comes to this time, as of yesterday, if we have more confirmed cases in the healthcare professionals, this is quite concerning. Then it means that, as you mentioned on your previous question, that if you have this kind of long lanes to get tested, then how are you going to protect your healthcare professionals? Because you really don't know whether those patients are positive or negative. There has been a 184 line for patients who are suspicious on COVID-19. So the plan was to call that number first and maybe to send an ambulance and just isolate them and get their testing in an isolated condition. But as you just have a lot of relaxation on your precautions and rules, people started to rush to those hospitals. So those videos, I believe, has never been seen anywhere in the world. So nobody is just waiting hours to get tested. So, and also if they want to get tested, there might be some mobile testing stations. At least people can stay in their cars. But if it's not the case, if they don't have their personal cars, there could be some sort of an appointment system that to minimize the social, interference with other people. So I believe that there is not an appointment system. Whoever wants to get tested can rush back to the hospitals, and we just get those really nasty, videos over the social media. I believe there is a huge concern about how to detect those patients. But if we look at Minister of Health, Dr. Koca's press conference yesterday, he was openly blaming the population due to this. But I think his role and his governance should direct the population. So instead of blaming the people, I think he should blame how this system was taken care of. So if you have more cases, if your death numbers are doubled over the last 2 weeks, then there should be some problems in terms of your management. So it's very easy to blame the population, but in that case, as a public health issue, one should blame himself first if he's making some results. And our population is just a very loving population. If somebody makes a mistake, if one apologizes, they can just accept this apology quite easily. So if there's a mistake, this should be corrected as soon as possible, and shouldn't be a concern and shouldn't be a worry, because openness is just the main issue. Transparency is the core of this fight. And in May, almost we are in September, almost 6 months after the outbreak, having 11% of healthcare professionals diagnosed with COVID-19 is completely unacceptable.
Yes, and it goes to show that, obviously the pandemic is not going to end tomorrow, and if the numbers of medical professionals being infected is so high, what does that, how is that going to affect, further treatment that's going to happen? As we mentioned earlier, we are rapidly approaching the official numbers that were given in March. And as far as, today, there have been some measures implemented, bizarre restrictions, I would say. Face-to-face education is starting on the 21st of September. The football games were going to begin with spectators in October, and I think they decided to finally revise that, which is obviously a positive step. But what are some of, I guess, the urgent steps that need to be taken, in order to prevent this sharp rise to continue?
I think the decision of opening the transferred hospitals, the buildings, as a pandemic hospital is a good decision. So as you know, in Ankara and in Istanbul, there has been many transfers of the existing hospitals to the city hospitals that they say. They are enormous, large hospitals, usually stated long from the city center. So in Ankara, there has been, I think, Numune Hastanesi and Yüksek İstat Hastanesi, these kind of hospitals has been sitting empty. So I think Minister of Health made decision yesterday just to go back and open those hospitals as a pandemic hospital. When it comes to taking precautions for the future, when it comes to Turkey, the Minister of Health has been making giving some names about the main cities that has the outbreak as at its highest, like Ankara, Istanbul, Konya, and some other cities. I believe some extra lockdown precautions should be taken on those cities. But this kind of question also directed to Minister Dr. Koca yesterday, and he just completely said, no, we're not going to make any, lockdown decision. But as I said, that in March and in April, I think the process was not done, was not managed very nicely, and the precautions were taken were not really satisfying. So we're just paying now the price now. So in this kind of level of understanding and in this kind of level of relaxations, I also don't blame Dr. Koca that it's very hard to make some decisions in terms of lockdown. But if we can still mention that Istanbul is Turkey's Wuhan, then I think this kind of lockdown procedures should be taken immediately. Otherwise, we know that many people are still doing their vacations, and we haven't talked about that. They're just gonna come back before the schools start. And like you mentioned, that starting the education and starting some, sports events with the spectators, they're going to be really very wrong decisions. But I think public health experts and epidemiologists will have better ideas and solutions in terms of this current situation in Turkey. But my personal opinion is that at least up on to those 10 cities, there could be some strict precautions and some decision making should be immediately done.
Mm-hmm. Yes, especially considering that the hospitals are basically full, the doctors are under a lot of pressure, so we need to somehow manage this process so that there's not a crack under pressure in terms of the health system as well.
I totally agree. Also, Turkish Medical Association has been excluded throughout this process. Mm-hmm. And today, the head of Turkish Medical Association finally made an appointment with Minister of Health, mm-hmm. which probably they are now having a meeting right now. We don't know the outcome yet. And since the very first day, Turkish Medical Association created a COVID-19 monitoring committee, and they worked really good. And most of the time, they just criticized most of the precautions that were taken. I believe it's not also too late to integrate Turkish Medical Association to the system, because our understanding is that Turkish Medical Association has now chambers in different cities, and just because of announcing the death numbers and the number of confirmed cases through the mayors and then the local chambers, I think the Minister of Health had some pressure on it and had to change the numbers. As you may remember, the medical chamber in Diyarbakir mentioned that, hey, Minister of Health, Dr. Koca, we have 15 deaths today. So let's see how it's going to be your numbers. So that day, the death numbers were like a flat line. It was mm-hmm. 15, 18, 20, and it will never been up before 20, above 20. And that day, the death number was 36. So that's why this medical chambers and medical association is very important. And there are 164,000 doctors in Turkey and 1.2 million healthcare workers in Turkey. And like Dr. Koca mentioned yesterday, 52 healthcare professionals lost their lives during the pandemic, which is not also reflecting the truth, because the healthcare professional definition is totally different. They don't count the cleaners, they don't count, it's a teamwork. So far, to my knowledge, we have more than 72 healthcare professionals lost their lives. So I believe Turkish Medical Association has a great role in terms of managing this pandemic, and I hope that the Minister of Health will give the opportunity to integrate Turkish Medical Association to resolve the current issues.
Dr. Ergin Koçyıldırım, thank you so much for having joined us and assess the recent state of the pandemic in Turkey.
Thank you very much for having me.
Tension in the Eastern Mediterranean continues to rise as Pompeo removes sanctions on Cyprus, Turkey extends Oruç Reis's seismic research time, Greece militarizes Castellorizo Island and threatens Turkish journalists.
U.S. Secretary of State Mike Pompeo made an announcement on September 1st that declared a decision to remove the arms embargo on Cyprus for 1 year. The announcement stated that the U.S. has decided to partially lift the 33-year-old arms embargo on Cyprus to allow non-lethal military supplies to be sold in the Mediterranean. Turkey immediately slammed the U.S. for this decision by calling the move incompatible with the spirit of alliance among the countries. In response to the announcement, the Turkish Foreign Ministry said that if the US does not reconsider its decision, Turkey will have to take necessary decisive countersteps, adding that the move poisons the peace and stability of the island. As the Ministry of Foreign Affairs condemned US's move that viewed this decision as a step against the recent Turkish actions to extend the maritime boundaries. U.S. Ambassador to Cyprus, Judith Garber, cleared the inferences by stating that the announcement was not related to Turkey, but aimed at reducing Russian influence in the region on September 2nd. The announcement came amid the heightened tensions between Turkey and its eastern Mediterranean neighbors, Greece and Cyprus, over the offshore energy exploration and maritime rights in the region. Turkey has been extending Oruç Reis exploration vessels' seismic surveys in the region through declaring Navtex alerts in a frequent manner. The latest extension alert came on August 31st, when Turkey declared that Oruç Reis will be continuing research activities until September 12th, which frustrated Greece. The heightened tensions between Turkey and Greece over maritime rights is beginning to have repercussions in different areas as both countries refuse to compromise. On September 3rd, an anti-Turkish Greek website threatened the Turkish journalists working for the state-run Anadolu news agency on Castellorizo Island. The website published a provocative editorial that stated, "Why do we allow Turkish spies of the National Intelligence Organization, MIT, to go to Castellorizo? Why did we let them set foot on the island? Don't we know that these MIT spies are trying to do? We hope the authorities will do what is necessary." The website also published Anadolu News Agency Athens representative Tevfik Durul's passport identity page. As the passport information should only be kept by Greek authorities, an explanation is expected on how the website obtained a photo of Durul's passport. The new agency's director, Şenol Kazancı, condemned the provocative editorial with the following statement. "Targeting two journalists who went to the island to follow up on news is a heavy blow to the freedom of press. We expect an explanation and an apology from the Greek administration on how the personal legal information of our journalists was leaked." In accordance, Communications Director Fahrettin Altun posted a tweet that said Greece will pay the price. "My message to Greece is as follows. You will pay the price if those Turkish reporters come in harm's way. Nobody can silence Anadolu Agency, whose staff work in the most hostile environments through threats, intimidation, or the publication of their personal information." There was another tension that arose on the same island of Castellorizo this past weekend, when the international press published photos of Greek troops landing on the island with a ferry. Spokesperson of the Ministry of Foreign Affairs, Hami Aksoy, published a written statement regarding the news that indicated Castellorizo Island was being armed by Greece. In his written statement, Aksoy evoked the 1947 Paris Peace Agreement and that the island needs to be in an unarmed status according to the clauses that the agreement abides to. If the news is correct, this is an indication of how unlawful Greece is and what their real intention in the Eastern Mediterranean is. We reject the illegitimate changes that are trying to be implemented on the Castellorizo Island. According to the Treaty of Lausanne of 1923 and the Paris Agreement of 1947, Greece cannot bear armed forces in any of the 12 islands. Greece has been undermining this law for years. The Greek authorities on the Castellorizo Island claim that the situation has been misunderstood and that it is a routinely conducted change of guards. Murat Yetkin evaluated Greece's stance against Turkey and the possible circumstances for a solution in a discussion with Ruşen Çakır on September 2nd. Murat Yetkin commented the following in the Medyascope broadcast. Greece is trying to mount from the anti-Turkish sentiment that has been intensified through the anti-Erdogan ideology and is attempting to obtain something from it. However, I don't think that these things will be obtained through the EU. Germany has portrayed an unexpected discrepancy in this picture. When Merkel stepped in as a mediator, it was supposed to mean that the EU was not going to back Greece in all cases, because that is what a mediator means. But what we have come to is Merkel's statement of, as the EU, we will be standing with Greece and supporting it fully. This annihilated Germany's position of a peacemaker. I think the solution will not be found within the EU grounds, as it is an organization that both countries are a member of. In accordance, in another Medyascope broadcast that Ruşen Çakır conducted with Ömer Taşpınar and Gönül Tol on September 2nd, Ruşen Çakır posed Taşpınar the hypothesis of Murat Yetkin and asked Mr. Taşpınar to comment on it. Mr. Taşpınar stated that, Murat's hypothesis seems to me like wishful thinking. Of course, this is what Turkey would want as a NATO ally, but solving this issue through NATO grounds would only be beneficial to Turkey if we assume that the US would be supporting us. If someone like Trump is in the White House, Turkey may have the upper hand. However, when we look at the latest announcements of the US Secretary of State Pompeo, they have also removed the sanctions on Cyprus. The US is holding a two-way structure right now. Trump and Erdogan are trying to get along, but the US Secretary of State, the Congress, the Pentagon, and the media is infuriated with Turkey. Consequently, if we throw this to the NATO grounds, it is not that easy to call it a piece of cake because NATO also includes countries like France. As of September 3rd, Turkey and Greece agreed to enter into technical talks at NATO to reduce the risk of incidents and accidents in the Eastern Mediterranean, said Jens Stoltenberg, the Secretary General of NATO. Greece and Turkey are valued allies, and NATO is an important platform for consultations on all issues that affect our shared security, Stoltenberg said in a written statement.
The Turkish Workers' Party Vice Chair and Hatay MP Barish Atai was attacked by a group of 5 people on August 31st in the Kadıköy district of Istanbul. The attack came following Interior Minister Süleyman Soylu's comments targeting him. In his criminal complaint, Atai called out Süleyman Soylu as the perpetrator of this attack. In accordance, the hashtag Barish Atai yalnız değildir, Barish Atai is not alone, went viral on Twitter.
Barish Atai, the vice chair and Hatay MP of the Turkish Workers' Party, TIP, was physically assaulted by a group of 5 individuals on August 31st around 1:30 a.m. in the Kadıköy province of Istanbul. Atai was leaving a restaurant with his friends when the group attacked him, allegedly calling Atai a traitor. Barish Atai was then taken to Haydarpaşa Numune Hospital and was treated for a broken rib and trauma. Shortly before the attack, Barish Atai was in the limelight for sharing a post on social media that infuriated the Minister of Interior, Süleyman Soylu. In the social media post, Barish Atai revealed the alleged phone messages of Musa Orhan, who was released from prison despite facing charges for sexually assaulting 18-year-old İpek Er and leading to her suicide. Atai tagged the Minister of Interior to this post and said, "You protected and supported a rapist. We will make sure that this will be held against you for the rest of your life and that you will never forget what you did." In response to this message, Süleyman Soylu tweeted the following: "You are the waste of PKK and DHKPC who became an MP of HDP through the instructions of rapist headman of PKK. I cannot be a rapist protector, but you would make quite a rapist. Watch out, the protector of Tuğma Çelik, don't get caught." Briefly after Süleyman Soylu shared this tweet, Barish Atai got attacked by a group of people who called him a traitor. 3 out of the 5 attackers were arrested over the claim of deliberate injury. During their testimony, the 3 suspects had said that the argument arose over giving priority on the sidewalk and that they did not know he was an MP until later on. After Atai was attacked, the Turkish Workers' Party, TIP, released a statement that said, "Targeted by Süleyman Soylu during the day, our vice chair was subjected to the attack of an unidentified group. The health condition of our comrade is good. The attack was condemned by CHP and HDP members who reached out in support of Atai." Barish Atai held a press conference at the Yoğurtçu Park in Istanbul on September 1st regarding the incident. "As a result of the system that they created, it is obvious that we are living in a rape society. That's what we have been trying to point out in the last couple of weeks. They trust the uniforms on them, the bosses behind them, and the ministers among them who give them the guarantee that they won't be held accountable. We witness what these people are capable of doing to women. As we are trying to inform the public, raise their voice, hold the wrongdoers accountable, this is the price we pay for the questions we ask. But this will never intimidate us, nor will it make us step back."
Sergeant Musa Orhan, who was arrested last month for the rape of 18-year-old İpek has officially been dismissed from his post in the military, according to an announcement from the Interior Ministry on August 31st.
According to the statement released by the Ministry of Interior, Specialist Surgeon Musa Orhan, who is being prosecuted for aggravated sexual assault, has been discharged from the Gendarmerie General Command. Text messages between Orhan and a friend recently went public, in which Orhan reportedly wrote that he raped for 15 days straight. Later attempted suicide and subsequently died in the hospital. Orhan was initially detained in July upon complaints from Er's family, but was later released. He was then arrested in August, but released a week later. A court has ruled that arrested lawyer Aytaç Ünsal shall be released. Ünsal has been on a death fast for his right to a fair trial for 213 days. Ünsal has been hospitalized in the Kanuni Sultan Süleyman Training and Research Hospital, a pandemic hospital in Istanbul. Another lawyer, Ebru Timtik, lost her life on August 27th on the 238th day of her fast. Charged with membership of a terrorist organization, Ebru Timtik was sentenced to 13 years and 6 months in prison and Aytaç Ünsal to 10 years and 6 months. The case filed against the lawyers of the Progressive Lawyers Association is still pending the final verdict of the Court of Cassation.
That's all from This Week in Turkey. See you next Friday at 9 p.m. Good night.